Good morning. Brittany tells me that we're ready, so I guess we are. Good morning and welcome to the third Breakfast with the Expert for this spring semester. Before I introduce our speaker today, I just wanted to mention that we have with us this morning Mr. Kathlyn Terry. Kathlyn has been joining us, on Tuesday mornings for this program, specifically as a resource, from Career Services. Kathlyn is the Assistant Director of the Office of Career Services and has served in this role for 18 years. He's here to help you with resume development, with interviewing skills, with locating internships and jobs, and he even tells me that they now have online interviewing capability to where you can go online and practice your interviewing skills if you do not or are not able to do that in person in their office. So he brought with him some flyers outlining the services that they provide, and those flyers will be available as you leave the room earlier this morning. And he will be with us also if you have any questions for him later on. So thank you, Kathlyn.
Thank you. Thank you very much.
Sure. Okay, so one of the goals of the Breakfast with the Expert program is to give you, our students, the opportunity to meet and learn from experts representing the wide variety of organizations that make up our public health system. And as we all know, nonprofit organizations represent a major pillar of our public health system. So today, I have the great pleasure of welcoming to campus Ms. Kathlyn Terry, Executive Director of Appalachian Sustainable Development, a leading nonprofit community-based organization that is focused on empowering and advancing our underserved Appalachian communities through economic development initiatives, food security initiatives, sustainable development initiatives, and other types of related efforts. Kathlyn leads a highly dedicated team of program coordinators, staffers, and volunteers who work tirelessly to improve and enhance population outcomes in our region. She is a highly respected leader and is very much admired for her ability to engage community stakeholders as well as other organizations in collaborative partnerships and collective action to achieve sustainable change. So we thank her for being with us this morning to share the mission and the approach of her organization, as well as the challenges and the triumphs of working in and with underserved communities in our region. So thank you, Kathlyn, for your time. Thank you for all the goodies that you brought with you, including this fantastic local food guide. So I will be reminding you again later on to pick up some of those goodies on our way out, because Kathlyn does not want to take them back with her. So thank you again.
Well, that was quite the intro. I'm not sure I can live up to it, but that's great. Thank you. Thank you all so much for being here bright and early. And I'm really excited to be here. We were just talking about how many people ASD's had the privilege of working with in this college, and I love the whole philosophy behind the whole College of Public Health. It gels with where nonprofits are going, and it's just, I'm just excited to be here and talk with y'all. I would really like it if this is more of a conversation than me being a talking head. So don't hesitate to interrupt me or stop me or whatever so that we can have a conversation. Have any of y'all heard of Appalachian Sustainable Development before? Do you have a clue what we do? Yeah. I mean, a lot of people don't, just because what we do is, as Amal so eloquently put it, I was like, wait, I could take notes because our elevator speech needs some help, but that was really good. But this is our mission statement that's yet again undergoing some tweaking. Just that we grow food, communities, and opportunities to build a thriving Appalachia, which doesn't tell you a great deal about what we actually do. We are a 501c3 nonprofit. We are 21 years old this year, and we do promote sustainable economic development, among other things. And we work in 3 different sectors loosely. And I'll just kind of run through. I wanted to. This presentation is going to be sort of like, have you seen comedians who like have horrible transitions? That's what this is going to be without the humor. So, I mean, because I was trying to talk a little bit about our work and then talk about kind of what we're seeing as what's happening in the nonprofit sector. So I try to make it not disjointed, but it is. So I own that. So a couple of the programs that we operate are in the wood products business. If you look around what we have in this region from an asset perspective, we do have forest and we do have ag land. And those are obviously opportunities that we would like to explore as sort of an asset-based economic development organization. And so agroforestry, that program is about finding products that can earn income for farmers or landowners. For instance, if you want to protect a riparian buffer and protect a stream bank, let's plant something in it that can make that farmer money. So that's one of those programs that we have. And then this program, this Woodright program, is actually an enterprise that is designed to create opportunities for wood products manufacturers. Back in the housing downturn, we lost, I don't remember, I think it's like 69% of our production capacity just because they couldn't stay open anymore. So this enterprise, I'm not going to talk that much about it today, but it's designed to try and bring opportunities into Appalachia that people couldn't necessarily have the bandwidth to go out and get themselves, because the big building jobs are not in Appalachia, as you can imagine. They're on the periphery in Charlotte or DC or Chicago. Probably what ASD is best known for is our agriculture programs. So we have y'all ever heard of a food hub? Food hubs are the USDA's sort of solution du jour to fixing part of our broken food system. And part of that system is that if you're a really big farmer, fairly near a large market, you can get your product to market without a problem. If you're a small farmer, and you're in central Appalachia as an example, how do you get your 20 boxes of something to Atlanta? You don't. It just isn't a possibility. And so our food hub is 16 years old, which is, I think someone referred to me as a grandmother of food hubs the other day, which I found really appealing. That is basically, I'll talk more about it, but basically that's the role we serve, is making that connection between small scale and medium scale farmers and markets that can earn them income. The Appalachian Farmers Market Association, I don't know if y'all know that there are 35 farmers markets in Southwest Virginia, Northeast Tennessee. It's crazy, and not necessarily great, because if you're a farmer, how many of those do you have to go to sell your products? But we run this association that is basically a peer learning network for farmers market managers so that they can become more successful. We also pass through double value coupons to the farmers markets that can handle that, to double SNAP benefits. So if you take your SNAP benefits to a farmer's market, we can double, and we're hopefully this year maybe even tripling how much you get. So you can get 2 for 1 if you buy fruits and vegetables. It's kind of trying to reinforce healthy eating and reinvesting in the community. We have Rooted in Appalachia is a campaign that we started because we really believe that more local businesses, local restaurants need to serve local food, buy from local farmers. And there's not that much of that happening here. We all know we're not Asheville. There's not just this huge community of that. And so we feel restaurateurs are not going to spend more money on local unless we as the community are asking for that. So that's what that program is, and hopefully you'll be hearing and seeing more about that soon. For instance, those two, the Appalachian Farmers Market Association and Rooted in Appalachia, we have a road show that we have a little 16-foot box truck that's really cute. It's got a big wrap on it with veggies and eggs and stuff on it, and we're going to go to 14 different farmers markets from Clintwood, Virginia, out in the middle of nowhere, to Kingsport and other areas, and I think Jonesboro. And what we're going to do is just really promote that market. So we're going to have lots of festivities around it. So we're going to do 14 of those the next 2 years to really promote those programs and to get people and to really be deliberate about and intentional about getting everyone in the community. Because some farmers markets, I mean, Abingdon is totally guilty of that. They seem to attract, a certain socioeconomic section of our town, and the other people feel left out or they don't feel comfortable. And so our goal is to drag people in there and get them part of the community. And then finally, we do a lot of education and technical assistance. And this is why I'm nattering on. This is why I was like, her summary was much more succinct than mine's going to be. But this last section of work that we do is around food access. You could say that we should be addressing food access in our food systems development work, but because our farmers are very limited resource themselves often, we don't want to go to a farmer and say, hey, you should, I know you're almost in a food pantry line yourself, but you should give away part of your food to those who are in need. We just can't do that. We've got to find ways that are beneficial to both parties. So that Healthy Families Family Farms program is one of my favorites. We've given away over 1 million pounds of food since 2004. And what we do is we raise money in the community so that we can buy seconds from our farmers, and then we donate it. And that is a win-win because those seconds, they're basically things that won't make the grade for a wholesale market. They need a home, and they're perfectly healthy, good food. This way, it gets healthy food into food pantries and food banks that don't normally have it. We have a Learning Landscapes program where we teach youth how to grow food, connected to standards of learning and other testing things. And then this picture, which I just love, we've been working with special education students, and they're actually learning to sell at a farmer's market. They've learned to grow, they've learned all the different pieces of it depending upon their capabilities. And what I just love is the story of it's not just like learning how to make change and all of that kind of stuff. It's learning to be quiet, not comment on what someone might be wearing, and just learning some of those soft skills that they don't necessarily have in a really useful environment. We have a program where we teach low-income people how to grow food in their own gardens. And so we give them tools and supplies. And this year we have a connection to the Beginning Farmer and Rancher program in Virginia, where we're teaching them to also sell at the market. So don't just grow and give away and eat, obviously, but grow and learn to maybe earn some income from that. And then finally, we work with seniors and those without land or with some physical disabilities to grow in gardens that are on casters so that they don't have to bend over, but they're very productive gardens. So that's the, believe it or not, high level of what we do. I put this up here. This is maybe difficult to read, but basically we try and approach all of our work as being on a continuum. So I think in the distant past, we were a bit guilty of saying, by God, you should grow organically. And if you didn't, then we couldn't have a conversation with you anymore, because that was all we cared about, was that you would become an organic farmer because that was good for the earth and everything else. Over the years, and I'm probably showing my middle childness, I want us to all get along, and I want to meet you where you are and move you wherever you can go that's more sustainable for you economically, environmentally, however it works. And I put together this food access continuum because it's sort of how we think. Giving away the free food at food pantries is awesome. We need to do that. That's a really great thing to do. But that does not give you access for much more than when that's gone. It also doesn't mean that you even know what to do with it. We used to have so many eggplants that we would have as seconds, and we would show up with eggplants, and we were not greeted with love because no one knew what to do with it other than maybe deep fry it. And so we had to come up with, here's what we got, and here's how you can make it so that you might actually want to eat it, although eggplant still was a high bar to crawl over. But we moved, we're now over in all of these areas, really trying to push people to think more positively about what their opportunities are. When I first started working in nonprofit, just to give you 2 seconds about myself, I have most of my background is in private industry. I've now been in the nonprofit sector for 10 years. And I think that I think that's why I like public health so much, is because I finally snapped after 10 years that it is way ugly, complicated, and complex, and it was really simple when I was in business. Life was so much easier because you just looked at one thing, and that's what you focused on. And then when you get into making social change, it's a whole lot different, and that's one of the things that we've seen with gardening. It is empowering, it is not judgmental, it is something that you can do if you have 5 felonies, or a disability, it's whatever. And so that's one of the things that we have seen. It really does change the way people think. And as jaded as I am as a business person, that's a pretty bold statement, and I really do believe it. One of the things that we're seeing in terms of what's changing in the nonprofit sector, and again, I've been in it 10 years, is I think that people, and especially in high areas of high need, I think we're starting to get the fact that it is really difficult for us to do anything on our own, to make any change in a social problem, which in my belief that I have acquired over the last several years is everything comes back to a social problem. And so in order to change that, we can't do it individually. And I think one of the things that I'm most excited about is that now this fractured relationship between grantors and grantees is starting to get a little better, because it's been so top down that, we want to fund this, you go do it, and then we sit there and tell you that what you want to hear, and which I don't do well. And so I'm much happier now that we're actually co-creating strategies between funders and practitioners. I was in a meeting in DC last week for something called the Just Transition Fund. And what this is it is a group of funders that have gotten together to fund the transition from coal and power plant impacted communities to come up with just ways for everyone to be involved in some new economy. And it literally was funders and practitioners together working to try and figure this out. It is too hard for anyone to expect that one agency, one nonprofit, or one grant maker is going to know how to fix it or has the resources to fix it. So I feel like that's hugely positive. It's not by any means a done deal. I know one of the groups that we work with, the food system people get it, and they want to work together, and the health practitioners have no desire for the practitioners to be in, the health funders have no desire to work with the practitioners. And I just laugh because I'm like, good luck. But it's getting there, and that's huge. There's also some other things, and I hate to use buzzwords, but I will be using a few. Impact investing, have y'all heard of that before? It's basically now it's almost like you got to think like a business, because a funder wants to invest in you, and they want to invest in the outcomes that you have. There's also, especially when you're talking really rural areas like we're in, networks and networks of networks to try and help get money out to areas and get support and resources and capacity. Social enterprises, again, I might be probably more jaded than some are about social enterprises, but I'll talk about that here in a minute. And then collective impact strategies. I'm sure y'all have talked about collective impacts a lot. Are y'all familiar with that whole concept? Not so much? Okay, well, I'll talk to you a little bit about what that means. So jumping back onto our practical nature. So I mentioned Appalachian Harvest at Food Hub. Basically what we do is we work with farmers, and they bring their product to our facility, which is in Duffield, Virginia. Any of you know where that is? It's out in the middle of nowhere, and it's surrounded by mountains, so it's kind of like a brilliant place to put a place where you need to grow vegetables, but it's where we need it to be. So we take product from there, and we sell it to large wholesalers. So we don't go to a store, we go to a distribution center. So we go all the way down to Atlanta and all the way north to Maryland. We have 2 tractor trailers, and we haul food to where we'll get the most money for our farmers and where there is the biggest market. We have also managed to get some value-added products so that we can try and get some sales going that are more year-round, because a lot of what we sell is produce. We have had to kind of help our farmers get over the hurdle of accessing these markets. They have to have a pretty stringent food safety certification that we help them get. They have to understand the quality requirements for this. So we do a lot of that training. Over the last few years, we're at about an average of $1.5 million in sales, and we still haven't broken even. But what we struggle with, and this is just something else to be thinking about, and why I struggle with social enterprises being this answer for nonprofit funding, is that we've been doing this food hub for 16 years, and we have finally gotten it down to 8.75% grant requirements. And I'm very clear on that number because that is my driving goal right now. Because I'll rant just a moment about social enterprises. We have a lot of people going into food enterprises because food is a great opportunity for people, but it's also a risky endeavor if you approach it with just your mission in mind. Because if Appalachian Harvest goes away, all of the work that we've done to help get those farmers to market goes away. And then those people may be worse off than they were. They probably will be worse off than they were before we got there. So as good stewards of our work, we better be thinking of, like a business, about how we're going to make this sustainable. And that probably seems fairly obvious, but it is not. I am probably, thank God, I've been griping about this for long enough that it's starting to kind of resonate. And we're also hideously transparent about all of the warts and difficulties and challenges that we've had. And people are starting to have these conversations about, oh yeah, well, we're not profitable either. And it's like, okay, I was in a room the other day where someone had made they'd finally gotten to earning $40,000 a year. That is income generation. That is not profit. And they have at least 4 people working for them. I do not know how that is going to be sustainable as a business model. Now, if they can get funders to really long-term invest in that, completely different thing. But that's the kind of thinking that if you look at social enterprises, and more nonprofits are looking at social enterprises, you really got to think, you still have to think like a business person. You still have to look at what your long-term strategy is. And in our case, we do everything we can to earn money. So when I said we went down to Atlanta, we actually go just north of Atlanta to the Whole Foods distribution center there. Then we go into Atlanta and we pick up a load of whatever. It's usually either dog food or baby formula, and we haul it all the way back up to Abingdon and drop it at Food City's distribution center because we earn income doing that. And that way we're not heading back empty. And we do that all the time, as much as we possibly can, to try and earn money so that we're covering as much of our costs as we can. So things like that are just necessary.
Yeah, so just so I understand correctly, so you still have to rely to the tune of close to 10% on external grants to help offset your costs so that you're not losing money. What is your primary source of those grants? Where do you get most of that from?
A lot of it's USDA. A lot of it. There's not that many private foundations in our area, but fortunately, USDA's focus on local food has helped a lot. Unfortunately, another phenomenon that's lovely about nonprofits is it's very difficult to find grant support for general operating. And so someone who, one of my colleagues, I thought her analogy was really great. And so you've got this really anemic little sapling that is your operations. It's how you do your business. And in order for you to get general operating, you got to bolt on all these programs because you got to do more and more because funders don't want to fund what you did for doing. They want to fund what new stuff, new, fine, shiny, cool things. When I first started writing grants about 5 years ago, I got a response that they're just wanting us to fund what they're already doing. And I was like, well, yeah. And then I realized that was not going to ever get me anywhere. And I'm a lot more successful now. But that's the point, is you've got to always be crafting this to be new. So fortunately, with Appalachian Harvest, as this whole grandmother of doing this, we have, we're sort of in the forefront of a lot of things. I don't know if y'all have heard of the Food Safety Modernization Act. I can always tell them I'm not in a room full of ag people. That is just this hideous thing that is great and necessary. It is the government's response to foodborne illnesses and that type of thing. And it trickles down to small-scale farmers in a really burdensome way. And you've got large-scale ag that is just A-okay with it really negatively impacting small-scale farmers. And so those kinds of things we're doing that also help pay a little bit of this. So it's not easy. And 8.75% of 1.8 million is still a pretty decent chunk of change.
Is this where some of the burden of having to label for farmers markets came upon the producers?
It could, some of it is, this is more, farmers markets have largely been exempted from this, but it's moving towards that.
Okay.
Most of this, so ASD, our Appalachian Harvest Food Hub, because we have small farmers dealing with really large markets, we hit that requirement way before anybody else did. And so we're way ahead of the curve on that, just because we had to be. But it's over the next couple of years, now they're starting to have to get farmers markets to train. A lot of the like labeling, like of your like canned goods and that kind of stuff, is state driven. And in terms of like, was it made in a commercial kitchen or et cetera. And so, because I know in Tennessee and Virginia, the requirements are different. So I guess what I have seen over the last few years is that there is a recognition that a nonprofit is still a business. It still needs to have a decent model. I think a lot of nonprofits are started out of a passion and a mission, and I think that is beautiful, but at some point it kind of has to evolve into what is your business model. One of the things that, I have a business degree, so one of the things that you hear all the time in a business degree is what's your value proposition? And you need to have a value proposition for a nonprofit just like you have to have as a business or a university or anywhere. Why would anyone pick you versus something else? Why would anyone invest in ASD versus the March of Dimes? You know, there are some things that just appeal to people's passion, but it's also, you need to be really clear about what that is and how you want to function as a business. I'm seeing a lot of really exciting entrepreneurial mindsets start coming into this, and that's coming with millennials, young people like yourselves who are not necessarily just driven by money as my generation was. And so now it's like, well, I want to do good, but it's, how do I do it in this really difficult economy where there isn't enough philanthropic money to go around? I should have included this number in here, that in rural philanthropy, there is maybe 1% of philanthropy goes to rural areas. I've read as high as 4%, but then when Ford and Kellogg pulled out, it dropped it like in half. So, anywhere from 1% to 2%. That's horrifying. And one of the things that we have to look at, and, I look to people like who are in this room, what are the metrics that make rural matter so that we can make philanthropy care about rural? Because I'm never going to compete on numbers with Chicago or Detroit or any other place that has, high poverty and higher population density than we're going to have in Clintwood. But that might be that the entrepreneurial mindset helps get there. Income generation strategies, that's not just social enterprises, but just thinking about what your ability is to generate income. And then I kind of touched on this earlier. I just really am passionate about transparency, and nonprofits have historically not been transparent because they have been punished for being transparent. And I'm hoping that I'm seeing a change that people are really appreciating that level of transparency. It's okay to fail. You know you're failing because Appalachia ain't perfect. So if everyone was as wildly successful as they're saying, then why isn't Appalachia perfect? And so being candid about that and really having that discussion is I think one of the most promising things that's going on right now. So the Central Appalachian Network, I've mentioned networks of networks. That's what this is. ASD is one of 6 steering organizations, and I just listed them up here. And we all do similar work. None of us are exactly the same, but it's a really awesome opportunity to get together. This network is, I think, 25 years old now. And so we've been working together a long time. We got funding from the Ford Foundation for a few years to really do some deep work in food systems. And we are working still on that. What this is a picture of, fuzzy picture, of all of the different organizations that we're working with, and it grows all the time as we reach out to more and more people. So we are working together. Here's another kind of change that I'm seeing is trying to work together across regional boundaries. If you think about food systems, they don't care about a border. The government cares about border. Municipalities care about it. There's a lot of prevention of working together regionally, and then you layer on competition for markets. I have a pretty big passion, even because I think it only makes sense for us to work together. Food hubs are great, but when they compete with each other, that drives price down, which means that where are we? We're back to square one. And so what we're trying to do is get people to work together as a region to not compete with each other. There is not enough supply. You saw that we had almost 1.8 million in sales. We could easily triple that if we had the supply. But we don't have the supply because the average age of a farmer is 58 and a half. And there aren't that many people who think, are any of you planning to be farmers? Probably not. Of course, you might not be in this college, obviously, if you were, but I dare say I wouldn't get much of a different response in the ag eco as at Texas A&M, which is where I went.
Change the age curve because it'll be when I retire. But
yeah, that's something. Somebody will be growing some food. So what we're working on, this is just another example of how you kind of have to think, is how do we connect people in remote areas of Central Appalachia with markets that can give them top dollar for their food? Well, one of the first bold, incorrect statements I made when I first started working here 10 years ago was, we're not in the distribution business, we're in the food growing business. And it's like, no, you're not. You're in the distribution business. Because if you don't get it from out there to over there where someone's going to buy it, don't bother to grow it. And so what's happened in West Virginia and Kentucky is there isn't that much production because there's no markets there and no way to get it out. And so our strategy is to link together some pretty strong NGOs like ASD to get access, and you can see the convoluted route that this will take to Duffield of all places, so that we can then get it to these large markets. And that sounds really simple, and it is horribly not. It is, how much does that cost? How do you parse out what you earn from that? How do you get farmers to the level where they understand that, yes, I know that's an edible tomato, but it can't go in this box to go to Whole Foods. It just can't. And so teaching people all of that and getting them up, it's a long-term strategy, but we really believe strongly that's a huge opportunity. With water situations in California and other places, and the fact that we have abundant water, we have the resources to make this shift. And so we're really working hard on that. Is that what you would normally, just curious, think a nonprofit would be doing? Yes, no? I didn't. But what I have learned is no one else is either, because there isn't anyone who's looking at this from a regional perspective. The USDA can't do that. They can fund us to maybe do that, but even they have their own little silos and other things. So that's something that's not something you would necessarily think of. That's normal these days in NGO world. It's not what you would normally think. I mentioned collective impact. Basically, the way I think about collective impact is I can't do this on my own, but don't ask me, if I'm already working 12 or 14 hours a day, don't ask me to tack on another 3 hours a day to help your agenda. But if we can all agree that this is where we want to go, so say we all agree we want a healthier Appalachia, then we each might have a role to play, and that role needs to connect with this greater agenda. And that greater agenda needs to be measured by something that we all agree says, so like in public health, life expectancy, if you're going to measure that, and we can all see what our pieces and parts are to connect to that, that's collective impact in my simplified term. I know it's more complicated than that. It has 5 different conditions, and those are, I had a better graphic, and then this morning I looked and I was like, it's got a typo in it, and it's all over the internet with that typo, and I was like, oh, I can't do that. So the only local example, or best local example of collective impact that I have seen, have y'all heard of the Healthy Kingsport Initiative? So I've been on the leadership team for that effort, and what I have really enjoyed about this is they keep having to get a bigger room to meet in, and they have started in a pretty decent sized room because they are getting it. They bring people to the table around things that are going to move Kingsport towards becoming healthier. Of course, they also have strong business people at the table because they see the value of that, which obviously helps. When you have an Eastman driving something, it often really is helpful. But they also didn't bite off more than they could chew. They picked 3 different areas, which are the areas that Healthier Tennessee also has, but they were really focused on what they wanted to do. They had their metrics, and consequently, they get people to the table to talk to them and to work on this. And so that has been an example, and they truly believe in that model, and it's been pretty cool to watch. And they're really well known in Tennessee. They were a pilot for this, and are really have done some great things. So I wanted to just give you a few advantages and disadvantages of working for a nonprofit. And I'll start with the disadvantages to get that out of the way. One of the things that I find really difficult, having come from a business background, is in business, I'm doing good because the bottom line is black and it's large. I'm happy. That number's big. Everybody's happy. That's only one factor in a nonprofit. How do you, if it's long-term social change that you're trying to make, if you just take obesity as an example, if you're trying to impact obesity, you're not going to do that in 2 years. So how do you know that what you're doing is actually having impact? That is difficult, and one of the things that I feel we're all struggling with, and it can become disheartening if you're trying to really push something that's very difficult. Work environments can be frustrating. Of course, you probably say that of anywhere, but burnout is really high. I didn't make a very informed decision when I made the leap into coming into the nonprofit sector. I was like, oh, this will be less stressful. And it's like, oh my God, this is horrible. I mean, because you are not only really trying to do something difficult, you are spending a ridiculous amount of time thinking about money, more than I ever thought about money when I was in business, because you are always trying to figure out how to fund your organization, and that is not an easy thing to do. So that, I have seen a lot of young people go like, oh, I don't want to be an executive director. I mean, I'll work in that, but I don't want to do that. And it's like, that has to change, because we don't need that generation running away from those kinds of jobs. We need to help make those jobs better. And so I say that is a disadvantage, but I don't believe that it needs to stay that way. Conversely, the advantages are pretty amazing. I'll give you one story. I have a guy that's working for me. He's like maybe 26, 27, and he had been working in private industry for a really large grocery store chain as a buyer. And he kind of wanted to make a shift. And so I tossed him into this fellowship program that we had. And he told me at the end of this fellowship program that he was just big-eyed when he got there, because he was like, you just expected us to just figure stuff out. And I was like, yes, we do. No one has the answer, so you need to go out and you need to like pony up some, passion and really network and figure things out. And that is both a scary challenge and a really amazing opportunity. It's a huge opportunity for growth, for creation and creativity. I have every now and then when I'm like, oh, I didn't get that grant. I'm fine. Maybe I'll just run back to private industry. And then I'm like, no, you can't. Now you're broken. I'm used to being able to sit there and say, that didn't work. Let's try this. And that's what you're supposed to do in this. So that's a good thing and a bad thing. I think it's an amazing thing if you have a passion for doing some different, some changes, making some changes in this world. One of the things that we've noticed is that the universe is smaller. There's a lot of people to connect with. If I had been in business, I wouldn't be meeting the governors and dealing with the people that we're dealing with, because everybody has a passion, or many people have a passion for this work. And that you can find connection points. I was on the phone yesterday with someone from the University of Arkansas, because they are some really sharp attorneys who are doing food and local type work, and they're going to help come up with this rural metrics thing. I'm not smart enough to figure it out. I'm only smart enough to whine about it and say, hey, this needs to be fixed. Go put brilliant people on it. And that's what they're going to do. And so that's really cool to be able to make those connections, and you just don't have that opportunity in many sectors. And I think that there are a lot of opportunities, and there's a hunger for coming up with strategies that are effective and will make changes in this world. This is just something I tossed in here this morning because I saw it last week, and I thought it really made a lot of sense. Y'all are familiar with Maslow's hierarchy. And this was sort of a takeoff on that. And what the point of this is that in today's economic situation, everybody thinks you need to start here. We need more economic development. We need more economic development. We need a big box to come in and save the day. And really, the reality is you need to start here with human development and go up. Because what they said is what we're doing is we're starting with it upside down. So we're going to prop up that upside down pyramid. And it's just not an intelligent or sustainable way of working. And so when I looked at this, I was like, yeah, it really resonated with me because that is what we see. It's all well and fine to say that there's all these opportunities, but if people are not ready to take advantage of them, you're making things more difficult for you than they need to be. And then just one last thing, volunteers are a part of one of the things that Dr. Wyckoff had mentioned when we were emailing was about using volunteers. And I kind of think of it as the care and feeding of volunteers and donors. It's like, how do you get them? How do you keep them? Where do you find them? When, like, for instance, if you're trying to find millennial volunteers, they're going to really volunteer where their peers volunteered after learning about it from word of mouth. Other folks you might reach in other ways, maybe flyers or whatever. We have definitely not made as good a use of volunteers as we should, because doing it takes a lot of time. And we do not have anyone that is paid as a staff person to really do that. United Way does an awesome job of managing volunteers because they have a protocol and they have people that is what they do. And so we still have great volunteers. I just think we could do even better. Last year, I think we had, under 900 hours of volunteer time, which is okay. I think it could be quadruple that with the programs that we have. Admittedly, not always in the summer when it's hotter than blazes do people want to come help at a garden. So some of our volunteer opportunities are not air conditioned, and that might limit the people who we have. And then just, making sure that I think that we had a conversation yesterday being really clear about what a volunteer is going to do. We have all manner of options. We really have decided we have to be much more deliberate about what we do and what we would like for you to help with. And maybe it isn't gardening, even if that's what we want. I think I might be out of time or close.
No, you're good.
A couple more minutes. So some of the fundraising trends that we have seen, because fundraising is a pretty huge part of being at an NGO. And I definitely mentioned kind of the co-creation strategies. Individual donors also like to really think about this as an investment. They like to understand what you're doing with the money. They really, I have one woman who walked in and has twice given me an anonymous donation of considerable size on the sole stipulation that nobody knows that she gave it. Other donors would really like it to be sung from the rooftops, and you kind of have to know, you have to be pretty aware of who you're dealing with and how to deal with them. We are very fortunate because we have someone who's focused on donor development and communications, and her communications have taken us from here to here. Because, y'all have heard me go on and on about what we do. Trying to communicate what we do, we were just in a paper for a USDA grant that we got actually through the Appalachian Regional Commission. And when the reporter called to ask me about it, I was like, I'm sorry, but I can't tell you what this is for in any succinct way. And I was waiting to see what it would look like in a paper, and I think he just ignored all of it because it's just too hard. And so her getting, our communications person getting some of this out there so that people can understand us leads back to people understanding us enough to donate to us. It's also, you have to be really aware of what your demographics are. I didn't include it in here, but there's a lot of research on, millennials and how much they give and how they think about giving are completely different from boomers. and the amount of money that is given is completely different. But you need to have a pipeline of people, and it's not all about just the money that you give. It's about the time that's invested and the influence that you can have in the programs that we do. I'm a big believer. We are a part of the public. We shouldn't just be responsive, because that means that you have to tell us what to do as the public. But we should be responsive as well as leaders, because we're taking public money, and we should be doing good with it and helping this community in whatever ways is relevant for us to help. For example, all of us are aware of the Wilmot and Mount States merger that isn't necessarily happening, but obviously is happening. And so we see huge opportunities with how can NewCo help this community by changing eating habits so that this long-term preventive care makes sense. And so we really believe pretty passionately in the connection and the intersection between food and health. I mean, obviously, we're coming at it from a food perspective. We're not healthcare people. We're not public health people. We're food people. But we know how to do that. And so connecting those dots and really building community and economic development around that is something that we're pretty passionate about and hope can come out of this. So keeping aware of those trends and opportunities is something that also is really critical when you're looking at this as an opportunity for employment. So what questions do you have?
So how big is your staff?
I counted the other day, and there are 22 of us, but probably 10 of those are part-time. We have to be and that's another thing about nonprofits, you sort of have to be nimble if you're getting a lot of grant funding. Because I don't like to cut salaries or staff. I'd rather staff conservatively.
Have you had any success maybe speaking with local governments in reference to making them see the benefit and possibly being able to supply a lot of the vegetables and everything to the school systems, a lot of other major
like institutions? Well,
yeah.
That's a really good question. We do have USDA has a farm to school program, and we got a farm to school grant. We're in the end of, or the middle of the second year of it, and gosh, it's you asked the right question, because it is more about local government, because your nutrition director who makes all the ordering isn't necessarily empowered to go off the reservation and do whatever she or he wants. And it's funny because like Bristol was one area where we really focused, and their government situation is not connected well to the schools. And school systems in general are challenging because their eating season is not the same as the growing season. And then when you go back to what we said before, which is that, what I said before, which is that we don't have enough supply for the markets we have, that doesn't make farmers excited about serving those markets either. My big thing on the schools and institutions is there are some states that have done a really good job of saying if you take state funding, you have to buy X percentage of your products locally. And we are not doing that yet. And so we have not had success in that. I will say that ASD has not had a big policy arm in the past, and we're really trying to move towards that. In fact, we had a meeting back in last October with a pretty decent group of like 80-something people, some of whom were in this room, just to get people on the same page about that kind of stuff. And one of the groups, the working groups that came out of that was about policy and economic development. And for my own self-interest, I want to be better at that. And so we actually are going to have someone help us move that a little bit further so that we can say, in Tennessee and Virginia, here are the policies that make sense. Here's what's working, here's what's not. But that's a really good point, that we could do better in this region for sure.
One other quick thing. Would the local restaurants, will the health department allow them to use locally grown produce and stuff? When I was on the coast in Virginia Beach area and Norfolk and all that, we couldn't use homegrown vegetables, canned anything. They wouldn't allow you if it wasn't prepared commercially and so forth. So you couldn't even use any of the fresh local stuff. You had to get everything shipped in.
Well, canned, no. Like even, I don't know if you've heard of the Harvest Table up in Meadowview. They were canning their own tomatoes because they serve only local food. And they went all the way to the General Assembly in Virginia to fight it. And they are not allowed to can their own stuff, much less buy uncertified. They can buy certified, but not uncertified. Fresh fruits and vegetables is completely different, right? There is no state or federal dictate that says you have to have a certain level of certification to sell into a restaurant. So you definitely can.
That's where the change needs to be made. On those levels where that you can supply.
Right. And so that's, the barrier is not that. The barrier is money. The barrier is it costs more to buy local, and if we're not asking for local as customers, why are they going to do that? Because you obviously don't care, you didn't ask. So why am I going to spend more? Now, some restaurants are just, they believe fresher is better, and like we had a house party Saturday, and the chefs, these high-end chefs from Chicago came in because they were friends of one of our board members. And we didn't know any better. We just bought frozen local meat. And he was like, I'm not using that. And we're like, oh, good. That was $90 in meat that we're going to have to eat. Because they get fresh is better and, all of that. But that's white tablecloth, high-end restaurants. That is not, one of my favorite places, the bar called JJ's in Abingdon. And I think I've finally gotten in this close. It's like, I spend thousands of dollars here. Surely, God, you can buy some tomatoes. So, but it takes doing that, and all of us doing that, not Kathlyn eating out entirely too often.
Kathlyn, you mentioned that the farming capacity, the growing capacity, isn't where it needs to be, that you could sell perhaps the quadruple amount that you currently sell at those wholesale markets in Atlanta or other areas. So what can be done to encourage more growing, more farming, more production in our rural communities? And is that something that ASD is thinking about, approaching that area? Is there funding
There is a
down the
lot.
pipeline
There is.
to
We do
work in that area?
Yes, we do a lot of work in that area. We are not alone in this region. That is a national problem. And so the USDA has a pretty good-sized program called the Beginning Farmer and Rancher Program, specifically to address that issue. And it is challenging because if you take Appalachia or Central Appalachia in general, their children are told, don't farm, get off the farm, go anywhere else, but don't do this. It's a hard way to make a living. The climate change, whether you believe in it or not, the weather has not been all that conducive to safe farming. Now, granted, if it's livestock related, it's not quite as bad, but if you're talking vegetable production, it's just a challenging way to make a living, and we're not raising our kids to look at that as a viable way to make a living. And, I had an attorney who volunteered with us for a while, and he was like, well, it's just basic economics. If the demand is here, then the supply will fill in. And I was like, absolutely. I said, but it doesn't, because you aren't factoring price into that. If we were paying $100 a case for tomatoes, we'd have farmers all over the place, but we're not, because we're Americans and we want cheap food. And so the price that we're willing to pay as consumers across this country, there's no price supports like you've got for commodity crops. Specialty crops, that's what, I didn't know that until I got into this work, is that the food we actually eat is called specialty crops, which makes me just scratch my head. And there's no price supports for that. Versus, grain and corn and stuff like that a lot of it we don't eat or we ship off. So it's kind of crazy. I'm not sanctioning subsidies and supports. However, an intelligent look at our long-term viability from a food perspective, because we are now at the point where we import more than we grow. And that is crazy. And so those of us in ag community are really concerned about that. Right now, we have a small program that we're working with 10 farmers, they're beginning farmers, who are also limited resource, and they have to create a business and a marketing plan to participate in this. And then we're giving them some free tools and stuff to entice them to do that. I thought creating a business plan would be a pretty obvious thing to do if you were going to try and make a living at this, and it is not. Again, that is not just our region, that's everywhere. Because it's like a lot of people think, I got into this, you know, because I want to do it and it's cool. And surely if I've got money left at the end of the year, I did good. And that just, you know, makes me do a full body twitch because it's like, but maybe you should have done more of this and less of that. And so that's what we're trying to do, because if they're not profitable, then they're not going to keep farming. And so that's one of the big changes. And again, you know, you're hearing me preach this. This is being talked about at all levels of the USDA to try and make this change, because everybody is concerned about that.
Very interesting.
So just, I know this is, everybody wants to go, but I'm just interested to hear your thoughts on, just, I've never heard that statistic just because I haven't explored the literature, but the 1% of funding going to rural counties, which is obviously not representative populations, 20% of the country is in a rural area. And, you know, aside from density, you know, we have all the same or more of the health issues that you see in poor urban areas. And so just what your thoughts on why that challenge is there, that the funding is it that we're not telling the story? Because, you know, a lot of us work in rural health and think about this stuff all the time.
I think that we can't compete on, so let's give you an example. The Ford Foundation pulled out of Central Appalachia, the Deep South, and this area in Texas that they were working. And what I kept hearing was, well, there's this guy who got 9,000 Peruvian coffee growers all to get together to do this, and I'm sure they didn't give him that much money to do it. Working in the U.S. is more expensive. Working in rural communities is going to be more expensive per capita than it is in a more densely populated area. So it depends on the funder. So we have, for the last 3 years, gotten funding from Newman's Own Foundation, which has been a gift from God. Because yes, they track metrics, but they could go spend $300,000 building a house for a disabled veteran, and no one's questioning them because they don't report to anybody. They do what they do. If you are like the Appalachian Regional Commission, right now, what they care about is the number of jobs we create with this money, because they got $50 million. This year, they're going to get $50 million, hopefully, next year, all to put into Appalachia. They want to see job creation numbers. They want to see job creation numbers. So in a year, how many jobs do I think I can really create with, say, $1 million? Can I create 1,000? No. Can I say 10? That probably won't go over too well. And so they're just, I don't want to say guilty, but they got to go back to Congress to get money. The USDA has the same problem. So they have to show that their impact is worth the money, and there is not the level of attention being paid to what those numbers really are and what they really mean, in my opinion. And so that's why I really want to work with some pretty sharp people across this country who see this and say, so if we can't compete, I can't compete with New York City for how many dollars we can give out in Clintwood, Virginia, or Jonesboro at farmers markets for doubling SNAP benefits. And so I was on a stage with someone from, I can't remember where, there were 2 urban areas, and there were 2 of us, one from the tribal nation and one from Appalachia. And I was like, thank God she went first, because her numbers stank as bad as ours did. And we both went on a rant about metrics, because we can't compete. And so what you say is absolutely correct, but it's when it gets rolled up, it's this level where there's the problem. You know, your program officers get what you're doing and they understand it because they have the depth of knowledge. But if you got to roll up metrics of some sort, they don't roll up well. We look really anemic.
I mean, it's pretty much a classic volume versus burden. I mean, the burden is much greater, but the volume's just not there to justify that kind of investment. I mean, it's an uphill battle.
Mm-hmm.
Any further questions or comments? Kathlyn, that was very, very informative, very interesting. I certainly learned a lot. Thank you again.